Hello everyone, this is Dr.Nikhita, PhD scholar and MPT in cardiovascular and pulmonary science. In this video, I am going to explain about fetus blood circulation. As we all know, in a fetal life, there are some special structures present in heart of fetus which make some differences in blood circulation as compared with the adult healthy individual. As secondary, fetal life, fetus is not breathing, so oxygenation of blood will not occur in a fetal life. So let's see what are the differences are there. The content of this presentation is, first we will see the circulation of blood in a healthy individual, second we will see the special structure in a fetus heart, then circulation of blood in a fetus, then flowchart presentation of blood circulation, and last we will see the conversion of the special structure of heart after birth. This image shows the circulation of blood in a healthy individual. So as we all know that from the all part of body, deoxygenated blood will return to the right atrium through the superior and inferior vena cava. From the right atrium, it will move to the right ventricle through the tricuspid valve. From the right ventricle, it will enter to the pulmonary artery through the pulmonary valve. From the pulmonary artery, it will move to the lungs for the oxygenation process. After that, it will return to the left atrium through the pulmonary vein. In a pulmonary vein, there is a aortic valve. From the left atrium, it will move to the left ventricle through the mitral valve, and from the left ventricle, it will go to the systemic circulation. So you have to remember that in our body, there is only one artery which carry deoxygenated blood is a pulmonary artery, and only one vein which carry oxygenated blood is a pulmonary vein. Now the special structure which are present in a fetus heart are, first there is an umbilical vein which carry oxygenated blood to fetus, second there is a ductus venosus. So name itself suggests it will connect the umbilical vein and inferior vena cava. Third, there is a foramen ovale which is a small opening that connect the right and left atrium. Fourth, there is a ductus arteriosus which connect the pulmonary artery and aorta. Fifth and last is a hypogastric artery which is come from the descending aorta. So descending aorta will give two branches, right iliac artery and left iliac artery. Then both right and left iliac artery will again give two branches, right internal iliac artery and right external iliac artery, same as a left internal and external iliac artery. Then again both internal, right and left internal iliac artery will join and form the hypogastric artery. When this hypogastric artery leaves the fetus body, it will known as umbilical artery and it will return to the placenta. This image shows the special structure present in a fetus heart. Here you can clearly see the ductus arteriosus which connect the aorta and pulmonary artery. There is also foramen ovale which connect the right and left atrium. Then there is a ductus venosus which connect the umbilical vein and inferior vena cava. There is a umbilical artery which comes from the hypogastric artery. This image shows the circulation of blood in a fetus. So from the placenta, there is an umbilical vein which carry oxygenated blood to fetus body. When it enters the fetus body, it will give two branches. One branch will go to the liver and another branch will join with the inferior vena cava. From the inferior vena cava, it will enter to the right atrium. In adult or after birth, from the right atrium, blood will go into the right ventricle, and from the right ventricle it will go into the lung for the oxygenation process. But in a fetal life, there will be no oxygenation process will occur. So from the right atrium, it will go to the left atrium through the foramen ovale, and from the left atrium, it will go to the left ventricle, and from the left ventricle it will enter to the aorta and will go into the systemic circulation. This all about the inferior vena cava. Now we will see the superior vena cava. So from the superior vena cava, blood will enter into the right atrium, and from the right atrium it will move to the right ventricle. So here you can see there is a cross streaming of blood. One stream is moved from the right atrium to the left atrium, and another blood stream will move from the right atrium to the right ventricle. So there will be crossing of flow. From the right ventricle, it will enter to the pulmonary artery, and from the pulmonary artery it will go into the lungs. But you have to remember that here the blood will move into the lungs not for the oxygenation process but for the growth and maturation of the lungs. As we all know that for the growth of any kind of tissue and organs, there is a requirement of nutrition which comes from the blood. So here blood will move to the lung for the growth and maturation of the lungs, not for the oxygenation process. Some amount of blood is also into the arch of aorta through the ductus arteriosus, and it will last go into the systemic circulation. Here this is a flowchart presentation of blood circulation. So from the placenta it will move to the umbilical vein. From the umbilical vein it will give two branches when it enters the body. One branch will go into the liver, which getting 100% oxygenated blood, and another branch will join with the inferior vena cava through the ductus venosus. So you have to remember that in a fetus body only one organ, which is a liver, are getting 100% oxygenated blood. Rest of all body will getting a mixed kind of blood. Then from the inferior vena cava it will enter to the right atrium, and from the right atrium it will move to the left atrium, and from the left atrium it will move to the left ventricle. From the left ventricle it will move to the aorta, and this aorta will lead to a systemic circulation to all part of body, and from the aorta it will enter to the iliac artery which gives branches to the hypogastric artery, and when this hypogastric artery leaves the fetus body it is known as the umbilical artery, and from the umbilical artery it will return to the placenta. Now about venous return. So superior and inferior vena cava, which carry deoxygenated blood, go to the right atrium. From the right atrium it will move to the right ventricle. There is a crossing of blood streaming. From the right ventricle it will go to the pulmonary artery. The pulmonary artery will give some blood to the lungs for the growth and maturation of lungs, not for the oxygenation process. Some amount of blood will go into the aorta through the ductus arteriosus. Again there is a mixing of blood beyond the arch of aorta. So here the ductus arteriosus is present beyond the arch of aorta. So upper part of body, head and neck are getting good oxygenated blood as compared to the lower part of body. Now the conversion of the spatial structure. So as we all know that as baby born, umbilical cord is cut and clamped. So umbilical vein and hypogastric artery will collapse. Also in a fetal life there are more volume of blood is on the right side. So pressure is also more at the right side of heart. That is why blood stream will move from the right atrium to the left atrium. But after birth, when fetus cry, a lung will be active. So blood will move from the left atrium. So there will be also increase of pressure at the left side of heart. It will also lead to a closure of foramen oval, because there is a one flap is present above the foramen oval which will close because the left side of heart pressure is increased. So it will lead to physiologically closure of foramen oval at that time, but anatomically close after some time of birth. And same because of the left side pressure is increased, it will lead to the closure of ductus arteriosus. So before birth there is umbilical vein which convert after birth into the ligamentum teres, ductus venosus which convert into the ligamentum venosum, foramen oval which convert into the fossa ovalis, ductus arteriosus which convert into the ligamentum atriosum, hypogastric artery which convert into the obliterant hypogastric artery. Thank you.